The effects of morning versus pre-sleep mindfulness meditation on sleep health, mindfulness, and anxiety. In the United States, nearly 90% of children and over 30% of adults fail to reach their age group recommended quantity of sleep each night, according to a recent report from the CDC. Non-medicinal sleep aid interventions, such as mindfulness meditation, have gained popularity among Americans to aid with both falling asleep and receiving a high-quality sleep. One study found that a mindfulness-based meditation protocol produced higher sleep quality among individuals and additionally decreased sleep-related daytime impairment. Free meditation programs are now readily available to anyone who owns a smartphone. Many meditation apps have different programs that are tailored to be used right before going to sleep, but there is no research data to support that the sleep-specific programs improve sleep more than a program that can be taken at any time of the day. We have created a research study that puts participants through a meditation regimen at different times of the day and collects data pertinent to sleep and emotional well-being. There is no prior published research regarding the effects of time-specific meditation, and this study may offer insights for improving meditation interventions aimed for improving sleep health. This study aims to recruit 24 adult participants, 12 male and 12 female. After successful recruitment, the research team will affirm eligibility with participants through a pre-screening conducted over Zoom. Each participant will undergo a 4-day baseline recording period. During this time, participants will receive a Philips Spectrum Pro actigraphy watch system, which will evaluate physical activity. Specifically, this watch will measure and quantify sleep quality, sleep onset latency time, sleep efficiency, and total sleep time. Participants will be asked to go about their week normally, but avoid meditation. At the end of the 4-day period, participants will be asked to complete the three questionnaires to quantify state and trait anxiety, 5 facets of mindfulness, and decentering. After the baseline recording period, participants will be randomized into one of two groups, a morning meditation group or a pre-sleep meditation group. After assignment, participants will wear the actigraphy watch for the intervention period, a 4-day period, and meditate for 20 minutes once a day at their predetermined time frame with the Insight Timer meditation app. At the end of this 4-day period, participants will be asked to complete the 3 questionnaires again to quantify state and trait anxiety, 5 facets of mindfulness, and decentering. After all data has been collected, we will use IBM SPSS software to analyze the data with the 2x2 repeated measures ANOVA analysis design. We will analyze the data with 2 conditions 2 times and use sex as a between subjects factor. Completing human subject research during a pandemic is difficult. Funding from Michigan Tech's Summer Undergraduate Research Fellowship, known as SURF, was awarded on March 11, 2020, the same day that the World Health Organization declared COVID-19 a pandemic and only 2 days before the United States declared COVID-19 a national emergency. We've had to make many adjustments to the protocol to accommodate for COVID-related safety precautions, and those changes have required several revisions for Michigan Tech's IRB. For example, instead of physically visiting the laboratory, all research materials will be mailed to participants and all orientations will be conducted over Zoom. Working through pandemic-related restrictions, in addition to other obstacles involved in creating a research project, like trying to find a meditation application to use, has allowed me to collaborate with my research mentors and Michigan Tech's IRB to provide an enriching learning experience. Additionally, Dr. Elmer from Kinesiology and Integrative Physiology and Dr. DeRocher, one of this project's advisors, published an editorial in Advances in Physiology Education, highlighting strategies others can take to move research forward during the pandemic. Moving on to future direction, we are very close to obtaining approval from Michigan Tech's IRB with the potential for an additional IRB approval from Purdue University Northwest. This would allow us to recruit participants from both locations. We will recruit participants, collect data, and run statistics as mentioned in the methods and materials section. We are hopeful that the current study results will provide clear evidence whether morning or evening meditation is more beneficial for sleep quality, provide baseline evidence for future laboratory projects, and spur more questions in the sphere of research. I'd like to thank Michigan Tech's Summer Undergraduate Research Fellowship for the funding support, and additionally, I'd like to thank my awesome mentors, Dr. John DeRocher and Bridget Morin, for their continuous support and mentorship. I'm excited for the future of this project.